The Navy medicine motto is world-class care, anytime, anywhere. And we take that seriously. And our research community also takes that motto very seriously. When you look at the number of people who are deployed in this pandemic, 7% of the forward deployed medical personnel are Navy medicine personnel. And so we have people all over, and they are in the fight against COVID-19 to keep our members safe.
Infectious diseases has been a core mission of the Naval Medical Research Center for a very long time. So we're already pre-positioned to fight this invisible threat. We have the resources to be able to look at diseases like this, emerging infectious diseases, and get on top of it pretty quickly.
We're able to answer very complex questions about what emerging pathogens are circulating, what is infecting different populations. We're able to characterize those pathogens so that we have a better understanding of what we need to be able to counteract them, what the medical providers need to be able to treat those that are infected with those.
The Navy response is certainly a very robust one, and it is one that's involving a lot of people here at NMRC that are really trying to meet those unique operational needs of the sailors and Marines. That being said, we're certainly not doing this in a bubble, but continue to work with our other interagency partners as well as our sister services in the Department of Defense as well. And that will continue to be the approach. It really is kind of an all hands on deck approach when it comes to not just NMRC, but also other research labs around the United States where we continue to share and discuss and support each other's research in order to make sure there's not duplicative efforts, but instead that we're synchronized in what we're doing and making sure that we meet our niche just as the other services are meeting their unique operational niches.
This disease is very infectious, and one of the things that gives this virus an advantage is that it is infectious enough to transmit rapidly from person to person, but that it also is invisible in that it's asymptomatic. So you may have a number of people, especially our healthy force that might be on our ships, that are asymptomatic, but they're carrying the disease.
We know that the median duration between when an individual is exposed to the virus and when they actually manifest symptoms can be 5 days. We think that they can shed that virus up to 12 or maybe even 24 and potentially 48 hours before they even start to experience symptoms. So you can have an individual who thinks that they're healthy and be exposing other individuals to the viral infection, thus allowing it to spread very, very quickly throughout our forces. We don't know a lot about this infection, which is really why we need to rely on research in order to answer many of these questions.
So we have 2 vaccines that we're working on, what we call our phage vaccine, and we have our polysorbent vaccine.
In reality, it takes quite a while. I mean, if you are going at a normal pace to develop a vaccine for a particular viral infection, it could take, if everything runs smoothly, 5 to 10 years. And what we're trying to do, because of the severity of this epidemic, is compress that 5 to 10 years into a year and a half. And you can imagine the effort that it takes to do that.
So in this current situation, like COVID-19 situation, we need to develop vaccine very rapidly. So the work here, what we do here is actually related, all of them are bacterial virus. It's called bacteriophage. These viruses are unique. They only infect bacteria. They don't infect us. Using this phage particle, we can develop vaccine within very short period of time. Making vaccine for COVID is not an easy thing. So we have to be very careful, and we have to understand the COVID-19 virus properly and select a very unique sequence from this virus to make a safe vaccines.
We have been working 7 days a week without a break. Oftentimes we are working, 15, 18-hour days.
The battle rhythm you kind of get into is similar to what you're on deployment. You start off early in the morning, it kind of goes on later on to the evening. And for me, it somewhat feels like some of the battle rhythm I had when I was in Afghanistan. We're fighting this common enemy of COVID, so we're marshaling the forces, and it's all hands on deck as we fight it.
The mission, that's what it is. Being a microbiologist in the Navy. I mean, that's what we're here for. That's what we're signed up for. I was involved in pandemic H1N1, back in 2009-10, and this is similar to that, although it's a much larger and much more different moving parts. There are definitely some tough days where energy levels go up and down, but that you see the, I wouldn't say you see the end goal, but you see the impact that you're doing, and hopefully we'll get there in the end.
It may look bleak now, but there will be a vaccine and there will be drugs that will be effective in treating this.
I know right now we're in a scary situation, but I'm confident with our sailors that are actually on board deployed right now, that helping out, supporting the pandemic, that they're going to do a good job to actually meet this mission and find a cure. We can assure you that our team is out there to help out and support and meet the mission.
We're gaining understanding every day of how this disease works, how it progresses, and how to stop it. And I think we're coming to understand how this is. It's going to be, as the Surgeon General says, this is a marathon, it's not a sprint. So we're in it for the long haul, but we'll be fine at the end.
Yeah, ultimately the mission is worth it. We have a really energetic team. We have a team that is so dedicated to the mission of a healthy fighting force, and we're here to do whatever it takes to make sure that that happens, that we can support the force and make sure we can continue to fight the nation's wars.
We do this work for the sailors and Marines who are out there on the front lines. And so I would say to our sailors and Marines who are in the fleet to stay positive. I would say to know that you have a medical community that is dedicated to finding a solution and keeping you healthy, keeping you in the fight. Again, this has been a 24/7 evolution. This has been an all hands on deck evolution. And for those of us in the Navy and the Marine Corps and in service, we understand what that means.
There are so many people who are dedicated to working on this virus and understanding more about it, that there is a light at the end of the tunnel, that people need to heed the warnings from public health. They need to stay safe. They need to wear their face coverings. They need to keep their 6 feet of separation. And if they can do that for us, then the work we're doing on our end to try to find additional ways to protect them, that collectively will get to that light at the end of the tunnel.